Hello, everyone, and welcome. I am Tiffany Marley, Vice President for Practice Transformation at the Partnership, and we are so excited that you've joined us for today's Learning Communities Resource Center kickoff. We often, during our conversations about the Learning Communities Resource Center, refer to it as LCRC. You might hear us say learning community. We're all talking about the same thing. Most of all, we are glad that you all have joined us today. And I am very excited to introduce a wonderful team of people who I get to work with every day and who we all work together to bring this important initiative to this network. And so I am pleased to just quickly mention my colleagues, and I'll ask Lily if you would just quickly introduce yourself.
Hello, Community Action Network. I'm Lily Seals, the Director of Practice Transformation.
And then off to Gabriel.
I'm Gabriel Smith. I'm the Senior Associate for Learning and Dissemination.
Laura. And you might be muted, Laura.
Program Associate for the Learning Communities Resource Center.
And try that one more time. We heard the last part of what you said. So that was Laura Griffin. She's our Program Associate for LCRC, and off to Amy.
I am Amy Roberge, the Program Associate as well for LCRC.
So again, we are so glad that you have joined us, and we look forward to taking you on a journey to learn a little bit more about the Learning Communities Resource Center, as well as why it exists and how you can get involved. Really, we want you to get engaged with this wonderful initiative and to just get us going, because everybody's going to get a chance to participate today. We'd like for you to use the chat window and provide us with your name and where you're located. So if you could write that in the chat. And why did you decide to join us today? What is it about what you heard about what we were going to be doing today that interested you? So if you could use the chat, make sure you chat to everyone so that we can see what you have to offer there, and we see you all talking to us. So thank you so much. So again, you're giving us your name, where you are, and why this webinar today, or why this kickoff event. Lovely, lovely, lovely. Thank you so much. And as you all continue to do that, I would like to invite us to ground ourselves in the promise of community action. And it says community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So may this promise inspire you and maybe energize you today as you're listening to us. It certainly informs our work and how we do what we do as a part of the learning community. So looking forward, we would like to just give you a sense of what to expect. During the course of today's presentation, we will provide you with an overview of the Learning Communities Resource Center. We'll talk a little bit about transformation, and in particular, how your peers in the community action field have been transformed as a result of their engagement with the learning community in the past. We will then dive in terms of letting you know how you can get more involved pretty quickly with our various activities or focus areas, and you can see those listed on the screen. So we have several groups ranging from our Achieving Equitable Outcomes for Families to Health Intersections, Building Resiliency Using the Trauma-Informed Approach, Housing Opportunities Expansion and Homeless Prevention, and Financial Empowerment. So we look forward to telling you more about that. And then the wonderful resources that we have developed and we have curated. We want to make you aware of those and let you know how to access those, as well as finally plugging you in to upcoming LCRC events. So with that said, we will move forward in the presentation, and we thought it important to just let you know, well, what is the Learning Communities Resource Center, or what is the learning community? What is its purpose? And really, its purpose is to provide an innovative space, for the CSBG network or the Community Action Network to learn about and really identify effective outcomes and effective promising and innovative practice models that ultimately help us to alleviate or interrupt both the causes and the conditions of poverty. And I emphasize that causes and conditions. And so we understand that the work is complex. And so in terms of our innovations, in terms of our promising practices, we have to look at poverty from both that individual level and the systems level. At the end of the day, the work that we are doing with you through the learning community is intending to help build your capacity as community action leaders to fight poverty more effectively. And so this graphic is something else. It's an eyeful, as it were. It is the CSBG, or the Community Action Network theory of change. And really it speaks to our North Star in terms of some of our larger outcomes that you see at the top. It speaks to our foundation or our assumptions that really centers on the performance of the 1,000 plus community action agencies, as well as state associations, state offices, and federal partners who are really working together to mobilize communities to fight poverty. And we feel that our collective effort to fight poverty is really achieved through not only the core principles that you see highlighted there in our performance framework, but really the day-to-day activities of what each of and every one of you engage in every day. And that's those services and strategies that you see floating right in the belly button, or right in the middle, let's say the belly of this theory of change. And so you think about employment, education, and cognitive development, income, infrastructure, asset building, housing, health, social behavioral development, civic engagement, and community involvement. There may be some other services and strategies that kind of fall underneath those various umbrellas. But I said all that to say that the LCRC is really here to take you all, agency leaders, on a journey of learning and thinking more strategically and innovatively in terms of how to advance the impact of those services and strategies to ultimately achieve that goal of fighting poverty more effectively. So moving on, we want to give a shout out to our funder, primary funder for the Learning Communities Resource Center. Really, the Learning Communities Resource Center was initiated through the U.S. Department of Health and Human Services Administration for Children and Families and Office of Community Services Vision of Community Assistance. I say all of that because all of that is important, because that entity really had a vision or saw the possibility in terms of us really dedicating resources and our efforts around creating a learning and innovations hub that could help our agencies really achieve that goal of fighting poverty more effectively. And I'm excited to say that this investment has been around a little over 7 years. So this is the fourth iteration of them funding the cooperative agreement for the LCRC, and we are able to see the impact of that in so many ways that we look forward to talking to you about today. So we want to thank them for that. And so here is a snapshot of the learning community. And I've mentioned that we've already been around for a little over 7 years. And historically, again, as a result of the investment from HHS, and then we had some investments from some other funders, some private foundation funding that really allowed us to cover even more ground within the context of this initiative. But you can see what our historic focus areas are there, and really many of them have given our network more information and more access to evidence-informed, evidence-based research, promising practices as it relates to those focus areas that have allowed us to continue to build on the impacts on the ground. And so really I'll call out whole family approach in terms of one of those historical focus areas, integrated services, results at the community level, decreasing homelessness, health intersections. So there's several that you see there, financial empowerment, and really those have all fed into our current focus areas that we are excited to talk to you all more about today. And really our core approach within the LCRC is for our efforts to be peer-centered. And so we have peer-centered learning community groups, which again are focused on evidence-based and evidence-informed practices. Our curriculum design is aimed to change organizational mindsets and to also change individual mindsets and to change individual hearts. And we have subject matter experts and organizations who are leaders in the human services field that really help us to build a body of knowledge that feeds into the focus areas that we have targeted. And then the other thing that we do and we are excited to do is to continue to listen to you all and your experiences of innovation, and to listen to the field, to develop resources, and then to make those as accessible to members of the network as possible. So this gives us another picture or another snapshot of the learning community framework. And so our goal is to make the learning as accessible as possible. And so we are able to do so through the partnership's national webinar series. Oftentimes you hear from members of the partnership on Wednesdays, what we call Webinar Wednesdays, but it's not exclusive to that, but we put on a lot of webinars. I've already mentioned that we share resources, engage in peer learning. What I haven't spoken about is one of our superpowers, which is technical assistance. And so really, it's this team that really works very closely with some of our national experts and a growing cadre of experts whom we call the Peer Expert Corps, which we'll talk about later, to provide some pretty customized technical assistance across those focus areas for the Learning Communities Resource Center. And so in addition to that, we facilitate what we call open learning community groups, and we'll talk a little bit more about those, but really those are optional open groups that people based on their schedules can opt in or out of, and just be able to make what they need to make of that, sort of given where they are at any point in time. We have intensive learning community groups which require application. There is a designated cohort that is enrolled in our respective intensive groups, and those groups meet regularly, have access to ongoing technical assistance, and really dig in terms of learning about their various innovation, but putting that innovation into a comprehensive plan that then gets implemented over time. And a similar thing happens with our communities of practice, and with our communities of practice, which we'll mention more about as well, along with those things that we've mentioned that happen with our intensive groups. Those groups have now investments from some of our external funders to fund some of their innovations on the ground, on that agency level, on that customer level. Additionally, they have access to coaching, but really all of the groups have an opportunity to play an important role in turning what gets learned outward to the larger Community Action Network into the larger human services field, so that all the innovations and best practices that we figure out that work can have greater potential to be scaled out and replicated over time. So looking at the next slide, here is a breakdown of our open, intensive, learning community groups, as well as our communities of practice. And Lily, I think it's time to hand off to you. Is that right?
It is. It is. We get to talk about the magic of the learning community. What is magical about the learning community? One, it's free access to field experts and technical assistance. Very, very similar to what Tiffany just talked about. You know, this is free access to subject matter experts who can help provide technical assistance and support you in your transformation process. You're also connected to people, organizations, and systems around a shared goal. You know, when we work with our families, we always talk about a support system, right? And you can have that opportunity in this learning community group to have a support system within your organization and external. Having a common agenda, metrics, and outcomes. Outcomes is a strong word. To learn and grow together. Innovations. How are we creating or having the most impact, you know, in this fight against poverty, right? That's what we're doing. So what innovations? Poverty is ever changing. So our approach has to be ever changing in that fight and in that battle. So, and we look to improve ability to achieve rapid progress. So we can move to the next slide. This is transformation at all levels. And a lot of times we talk about individual, family, and agency, right? We talk about our different levels. Well, the agencies that have participated in learning community groups have gone on to do amazing things. So we're gonna, as you look at this slide and you look at the information on this slide, I really want you to take a moment to let this sink in. By participating in an intensive learning community group, agencies have leveraged learning to secure millions in new funding. And that's not just like combined, like individual agencies have secured millions of dollars in new funding to support their work and to expand and enhance their work. Increased employee satisfaction. Why is that important? As we serve our families, it's great to have that stability, right? We always work towards stability for our families. So part of that is us having our staff that they know, that they build relationships with, right, to remain in place, and our staff being happy about the work that they're doing because now they're working with intention, right? They're working towards intention to build those outcomes for families to help them achieve their goals. Increased gains in client outcomes. I really just sort of talked about that. It is important when we look at, you know, we certainly look at our funding, but even as we look at how we work with our families, right? How we work with our families in ensuring that they're meeting their outcomes. That goes back again to employee satisfaction. I am satisfied when I know that my family is moving forward and I'm walking with them. We have had agencies who are recognized nationally for evidence-based practices. And as Tiffany talked about, the agencies that have participated in learning community groups, they are now a part of our peer expert core. So now if there is a technical assistance request, if you're moving through, just for an example, you're saying you're interested in whole family approach and you're going to move your organization in that direction. Well, there are organizations that have already made that journey, right? And they're now experts in that, and they can provide some assistance or provide some coaching, some mentoring for you. So agencies have transformed and now they're giving back. And that is a part of the magic of the learning community group. So we've talked about, those points on that last slide. Well, guess what? If you go to our whole family approach design briefs, and I will ask if one of my colleagues can actually place a link in the chat for you all, you will find these briefs, which are the journeys of some of these organizations that have leveraged funds, that have increased employee satisfaction. I'll give you an example that is on one of the briefs. Over a 2-year period, a number of the Head Start and early Head Start parents completing a training program or obtaining a credential or license during the program year increased an impressive 100%. 100% over a 2-year period. Amazing. So the whole family approach design briefs will give you a journey in their approach. So from the very beginning, it talks about their successes, their challenges, wisdom, their timeline. It's a resource for you to see that transformation, again, from beginning. And I'm not going to say end, right? Because we can always improve, and we're always moving. We're always striving for better. We always want better for our families. So you get a snapshot of that. And our next resource that is also available on our website, AntiPoverty Practice Case Study Series. This is, again, case studies of organizations or agencies that have gone through the learning community group. And this is a great resource. Again, you can look at successes. They'll talk about barriers to implementing practices, how they were able to overcome them. So these are resources in this journey of how they've been able to transform. And many, again, are a part of our peer expert core. So this is a resource for you. And I think we can put that in the chat as well. That's our learning community resource page that is off of our website. And we talked a little bit about open and intensive, and this is a chart that really kind of maps it out for you. So as we look at open learning community groups, some things are the same. So we have peer-to-peer learning opportunities. You have access to Community Action Academy. If you attended our March 17th webinar, then you may know a little bit about that. But if not, you'll learn a little bit more about that a little bit later. But it is open to everyone. All you have to do is register and come and learn for open learning community groups. So if you miss one session, that's okay. You don't have to attend all of them. That's different from our intensives. Our intensive learning community groups are just that. Attendance is required. Each session builds on the other. So it is important to be present. It is important to be engaged for your organization and for your peers, because that is how you learn and grow and transform your organization and your practices for the greatest impact for families. And now I know everybody's like, where do I sign up? So, so this is the part where we're going to tell you about our available intensive learning opportunities for our learning community group. And our first one is Achieving Equitable Outcomes for Families. Now, I'm very excited to talk about this. This is a different experience, and I hope everyone runs to sign up for this. This learning community group will use racial healing circle practices as a tool for bridging across differences. And as we look at what has occurred over the past year, we all know that we have differences, but how do we bring each other together? And how do we do that in such a way that we're creating space for our families to be successful, right? So we're going to enable staff to engage with families in a more human-centered interactions, right? Which ultimately leads to the activation of family voice and power in building equitable outcomes for social and economic mobility, right? And that's what we do at Community Action. And for those who attended MLTC, you understand the extreme power and engagement of engaging customer voice. But also when we look at our communities, right? How are we collaborating with other organizations? Because when we're looking at, our agency, we're also making referrals. We're also, building that community to support our families. Well, we're able to access strategies and help create pathways for collaboration and alignment and with community partners and stakeholders to engage in systems level transformation work. And we have the distinct pleasure of having our subject matter expert, Mimua, who is the principal of Interdependent Group, who will give you all a glimpse of what this experience will be like for this learning community group. And without further ado, I turn it over to you, Mi.
Hey, thank you, Lily. I just want to, at the front end, say how honored I am to be on this journey with all of you and to have been asked to participate in one of these intensive learning community groups. I also want to say that I've been getting some notification that my internet is unstable, and so I'm gonna keep talking, and then I may just take myself off camera to preserve the connectivity if it looks like it's becoming unstable. So, but I don't have any slides, so you're just gonna get to see my face on this slide while I give a brief background. What I'd like to do in the next maybe 5 minutes or so is to introduce myself to each of you, because for those of you who choose to become a part of our cohort in this practice model that we're hoping to seed so that we can take it out into our community partnership network. I want you to know that you'll be on this journey with me for likely the next 12 months. And so I guess I should advertise, right? So that you can, so that we can entice you to join us in our cohort. My friends and colleagues and team members at CAP always laugh when I say that
Mi, I think you may have frozen a little bit.
Just give us 1 second in this virtual world.
all right, can you hear me? You can hear me now. So I went off camera, maybe that will help. In any case, so that's just a little bit of my background and how I came to be in this work. Amy, if you can't hear me, just give me a thumbs up and then thumbs up, right? Okay, so you guys can't hear me. You can hear me. Okay, you can hear me. All right.
Yes.
So what I like to so I come into this work as a former politician, as a former executive director, and a recovering lawyer. And this has been one of the most inspiring journey that I've been on, and I just want to invite all of you to join me. So the Racial Healing Circle, or the Racial Healing Circle, let's see. Can you all still hear me? I'm getting a text message that you're not hearing me. Oh, okay. The Racial Healing Circle methodology was co-created by a cohort of healers, facilitators, and circle practitioners. We were all brought together about 10 years ago by the W.K. Kellogg Foundation as part of their racial equity America Healing Initiative under the leadership of their at that time, Dr. Gail Christopher, who was a vice president at the foundation. In the last 5 years, we have used the Racial Healing Circle methodology to support the rollout of the Truth, Racial Healing, and Transformation Framework, which is an offering that was crafted, again, with Dr. Gail Christopher's guidance at the W.K. Kellogg Foundation. In short, the Truth, Racial Healing, and Transformation Framework talks about the fact that the 3 engines to creating inequity in our society today are separation, the law, and the economy. These are 3 systems that not only created inequity, but has perpetuated racism in this country. And that while it is great that we all work in these 3 buckets, that to make permanent change, we have to be able to start at the foundational level, which is truth, or changing the narrative, or elevating the true stories of our life and lived experiences. And then racial healing and relationship building, right? So changing the narrative and then bringing in healing and relationship building in combination is what's going to create the public will, right? To then enable us to marshal our collective resources to do what is necessary under separation, the law, and the economy to make permanent changes to the inequities in this country. So the racial healing circles were crafted or as a methodology to support the Truth, Racial Healing, and Transformation Framework. But the Racial Healing Circle has also become a methodology that has been adopted by community organizations all across this country. The gist of the Racial Healing Circle, as Lily articulated in her introduction, is that it is a methodology that is about creating the container or creating space to strengthen relationships and build trust so that we can engage both in the personal and interpersonal transformation to enable us to both heal and to be in a mindset and a heart set to be able to achieve equity where we all need to do that, right? So it really is focused on the individual and interpersonal capacity, to be able to achieve equity and in essence, create a sense of belonging, right? Create a sense of belonging. So, yeah, the Racial Healing Circle methodology is not anti-racism work, right? But it is not about the symptoms, but it is about seeking the cure. We believe that racism stems from the illness and the false belief in a hierarchy of human value. To eliminate racism, we must address the illness. The cure to the illness of this false belief is to reaffirm our common humanity, right? And tremendous amount of research has been conducted that supports this, right? Supports this. In particular, I just want to lift up a lot of the mind science research around and recommendations around implicit bias, right? Recommends that if we habitually and repeatedly expose ourselves to situations and peoples who are perceived to be different from us, that over time, our brains can literally be rewired to the point where we start to perceive one another beyond this, the perceived other, right? That we start to perceive and see one another beyond us being the perceived other. This is what we're looking to happen in a racial healing circle space, right? This is what we're looking to bring about in the racial healing circle space. Over the last 5 years, maybe 1,000 practitioners have been trained to co-facilitate racial healing circles. I believe that close to maybe 10,000 racial healing circles have been co-facilitated all across this country. And in fact, some of the sectors like the American Library Association and the Association of American Colleges and Universities, similar and also partners to the Community Action Partnership, have begun to bring about their own cohorts of racial healing circle practitioners to seed the practice of racial healing circles within their libraries and their colleges and their campuses. So I am so excited to be a part of this intensive learning community group. We want to offer a cohort of you who are willing and who are excited an opportunity for the next 12 months to be with us in Journey, to learn, to take on the practice of becoming a racial healing circle practitioner. There really are three components to that journey. One, I call it the people preparation. Two is the practice preparation, and then three is the practice support, right? And so for the first maybe 2 to 3 months, we're going to spend a little bit of time doing the individual, right? For us to be facilitators, we may have to do some work on ourselves, right? And so there's the people preparation component of it. Then we will lead up to what I call the practice preparation, where we give you the tools and the opportunity to practice your facilitation skills and to actually co-facilitate a racial healing circle. And then we'll offer you individual and collective support as you go out into your organizations and your communities to co-facilitate and host racial healing circles. We will offer you practice and coaching, consultancy, and support to be able to do that. And it has been my experience that if you'll stick with us and we're able to support you in the next 12 months, that when we get to the other side, this time next year, that there will be an amazing cohort of you who will be ready, willing, and able to not only co-facilitate racial healing circles within your organizations, but within your communities, and you will be the first cohort of racial healing circle practitioners that then will partner or will become the foundation, right? What did Lily call the peer experts that then can become the mentors to the next generation, next cohort of practitioners. I will leave it at that. I think we have some logistical information to provide to you. And then I know I shared with Lily that I have to hop off to go to another meeting. I know you all have an amazing program after this. And so I'd like to maybe, if you have questions, I'm willing to take a couple of questions, but definitely can keep the conversation going even after this webinar.
All right, thank you so much, Mee, for being with us and sharing some of those overview details. And as we mentioned, we'll go through into some logistics just as far as how this will start to take shape. So through this process, participants will be able to learn the methods and the purpose of engaging in these circles through coaching support, and also be able to reflect on personal equity journeys and strengthening interpersonal equity capacities. And then finally, receiving the opportunity to be trained in co-designing and facilitating this practice in respective communities. And in addition, some expectations. So as Mee also mentioned, participation at the meetings will be required. And Lily also mentioned this as far as the intensive communities wanting to make sure that people participate so that you're able to get the full experience, and since the curriculum builds on each other. So facilitating racial healing circles at the annual convention, which will be in August, leading into September, and then bringing your experience back to your agency and community and sharing your experience with others in the network. And some dates to note. The cohort is planning on being May 2021 through March 2022. This end date will be determined depending on support that is needed. And then, as some of you may already know, upcoming on April 19th is the Racial Healing Circles for our Community Action Equity Summit. And then May 17th will be the orientation and kickoff meeting. And then the monthly meetings will continue on third Mondays. And those will be about 2.5 hours long. So the deadline for application is quickly approaching. It will be Friday, April 23rd, and then decisions announced around May 3rd. So definitely try to apply early if you think you may be interested, and preference may be given to earlier applications. We will continue to let you know and provide updates if any of these dates may change. So we have the link here, which we will also share in a follow-up email with the details, and we'll make sure that you have those details. And if you have any questions or issues with the application, we'd be happy to answer those as well. And with that, I will turn it over to my colleague, Gabriel.
Hello, everybody. I am new here, so excited to be here with you all. But I'll be talking about some of the available open learning community group opportunities that we have. So the first one will be dealing with health intersections. So our health intersections work, we're focusing on family and community level strategies. Just a second. All right, health and community level strategies that address barriers and leverage the connections within the health sphere to address the social determinants of health and promote healthy well-being for all. So the subject matter expert that we have for this one is Dr. Dana Long from University of California, San Francisco, out in Oakland, actually, the Children's Hospital in Oakland. So she has been a primary care pediatrician at the hospital for over 20 years. She's been working with the partnership for a very long time. But for the past 5 years, she's been the director of the Center for Child and Community Health at the University of California, San Francisco. And she dedicates her career to eliminating childhood health inequities that lead to poor health, financial, and educational outcomes for families and younger children on both individual and population levels. So as far as the health intersections convening, we will be looking at ACEs. That stands for Adverse Childhood Experiences. These are toxic stress situations that negatively impact the health and development of children that can last or have effects throughout the lifespan of that child as they grow into adulthood. So at the convening, we want you to learn more about the effects of ACEs, strategies for assessing and addressing these ACEs, and how a network of care can strengthen community-based strategies to reduce and disrupt the effects of childhood trauma. So upcoming opportunities to interact with this work will definitely be May 13th at the Health Intersections convening, looking at adversity, trauma, resiliency, and early childhood. Then on June 30th, we have a webinar with APHA, which is the American Public Health Association, and then also at our the annual convention workshop from September 1st to the 3rd. So then the next area will be building resiliency using trauma-informed approaches. So an overview of this would be that our work is focusing on building emotional resiliency and healing through trauma-informed approaches to promote well-being at the individual, agency, and community levels. So the subject matter expert for this one will be Dr. Denise Shervington. She has an intersectional career in public health and academic psychiatry. Dr. Shervington is the chair of psychiatry and behavioral medicine at Charles Sturt University, an institution dedicated to transforming the lives of underserved communities through health professions, education, and biomedical research and compassionate patient care. She's authored several papers in peer-reviewed journals addressing health disparities, the social determinants of health, and resilience in underserved communities. So upcoming opportunities to interact with this work will be June 2nd at the Creating Trauma-Informed and Resiliency Promoting Organizations webinar. And then in September for the Resiliency and Trauma-Informed Approach workshops at the annual conference. The next area we're going to look at will be housing opportunities expansion and homelessness prevention. So an overview of this would be that our work is focusing on a spectrum of housing challenges and opportunities, including homeless prevention and rehousing. The subject matter expert that we have for this is Sharon McDonald. She is a senior fellow for families and children with a focus on policy and program strategies to address family homelessness. She has experience providing service-enhanced housing and subsidized housing development for low-income families with children and in housing for people living with HIV/AIDS. She served as a social work fellow in the Senate, where she focused on welfare and housing issues. So upcoming opportunities to interact with this will be a national webinar series that we're starting where we're focusing on homeless prevention and rehousing. And then in September, we'll have workshops at the annual conference. And then finally, we have financial empowerment. So for this, our financial empowerment LCG will be focusing on financial education and asset management for families. Upcoming opportunities for this to interact with this work will be April 21st at the Bridging the Racial Wealth Gap Systemic Approach. Will be an Equity Summit session. So make sure you're signed up for the Equity Summit. And then on September 1st through the 3rd, we'll have financial empowerment sessions at our annual conference. And with that, I'll turn it over to Laura.
All right, everyone. So hopefully my sound is working now. If someone can give me a thumbs up, great. My name is Laura Griffin, and we've got a poll question for you, which is just to reflect back on kind of everything you've heard. What are you interested in participating in, or how do you see that you'll engage with this work going forward? The poll is a little slow opening, but we'll have it up for about 5 minutes, so you'll be able to answer that. And with this, I'm going to pass it over to Amy.
Thank you, Laura. So while Laura is gathering our poll results, we will just go ahead and go over a few more resources. So the first one is about Community Action Academy on the Moodle platform. So we have one new course, Advancing Family-Centered Coaching 201, which is a second part to the Family-Centered Coaching 101 course. So those are open to all of you, so definitely check those out. In addition, we have some topics on implementing Roma health intersections, upcoming CSBG organizational standards. So we are continuing to add more resources and courses on this platform. And then our next, we have our Equity Summit, which is coming up on April 19th to the 21st. And registration is now open for that, which I just put in the chat. And then finally, here's the Whole Family Approach Institute website page. So back in December, we had a Whole Family Approach convening. And so we have a web page full of videos and resources and graphics that are that you all are able to use for your Whole Family Approach work in your agencies. And with that, I can turn it back to Laura, and we'll see how's it going with the poll.
So you've got 17 more seconds to submit your answer. So we've got a lot of interest in kind of our different groups. So as those answers should pop up, I'm going to move right along to talking about one more fantastic resource that we have. You're already on a webinar Wednesday. We host many more of these throughout the year, focused on different kind of innovative practices for addressing poverty. Here are just some of the ones that we have coming up soon. As you've heard, we have our Equity Summit, which is a 2 to 3 day event, April 19th through 21st. We have on April 28th, the intersection of data capacity building and strategic planning. May 19th, a COVID-19 resource tour of resources we have here at the partnership. June 2nd, creating trauma-informed and resiliency-promoting organizations. And June 30th, we have one on health equity. So just as a brief recap, you've heard so much today, but what we really want to convey to you is just we have a real dedication to providing high quality content. That's both for our learning groups, but also for the whole network, the work that the learning groups do on their own, will then be shared out with you. So that means promising proven best practices, innovation methods for innovative methods for addressing poverty, experimentation, implementation of new ideas, access to resources to support these anti-poverty approaches, lessons from the field, shared learning and mentoring, improved data collection techniques, and rapid solution development as the complex world of poverty presents us with new challenges. So with that, we're going to open this up for questions. You can enter questions in the chat, and I believe we already have a few that we can share out.
We've had a few questions. I'm going to start with the question of, is there a cost associated with this? And while it was talked about, addressed in the chat, we want to make sure that you all know that this is free. So please certainly sign up. It is at no cost to your organization. We also have another question, and I invite any of my team members to join in, where it asks if the learning is exclusive to children and families, and it is not. While we certainly do work with families with children, you may also be a family of one, and we serve the whole family. So wanting just to make sure that everyone knows that this is not we are inclusive in serving our community as a whole. So all families. So if there is a matter that is going on in your community and you need technical assistance or support, that is something that you can reach out to. Reach out and receive support on. It is based on the needs of your community, the needs of your agency, and the needs of your families. So any other? I don't want to hog up all the questions, so let's see if there's anything else.
There's a question about like our focus related to seniors and elders, and just to be more explicit, we'll say that within the context of our groups, sort of based on the assessed need of the agencies, they may choose to target particular populations and innovations to meet those populations' needs. And so could certainly see opportunity for that in the financial empowerment space, even the whole family approach space, where we find that especially in communities of color, heads of households tend to be grandparents and older adults. And so there's certainly opportunity. There's a mention of social determinants of health, enhancements and improvements. And so again, we have some wonderful experts in our health intersections focus area, including the American Public Health Association and Dr. Dana Long, again, as it relates to targeting to the specific needs of older adults. There are resources and opportunities for agencies to learn in that space. And so I will emphasize that our superpower is technical assistance, and we try to be as customized to what the needs are for you all as community action leaders. And so as you're looking for certain resources, we are happy to curate those in response to your needs, and certainly put you in contact with experts who can help you think about how to address poverty for selected populations, and certainly inside of certain innovations. There was also a question about the Equity Summit and whether or not that there's a sliding scale for that. At this time, for the Equity Summit and the Partnership Annual Conferences, there is a fee. However, we work to still make those resources as accessible as possible. And so, if there's something that someone saw related to what's happening at the summit, and for some reason you were not able to attend, we could likely connect you to those resources after the event as well. And
Question.
yes, go ahead.
We have a question from Nina Walker. Will there be other information regarding the housing expansion and/or financial management topics? If so, is there a date for those topics?
So those topics are still under development, and so as we're continuing to plan and design with our subject matter experts, and so as more specifics related to those come out, we will for sure make that available to the larger network. And in the meantime, if there are specific needs for resources or information, feel free to reach out to any person on this team and we can connect you to the right resource in those areas.
We have another question, just to clarify if LCRC is open to all staff or key staff in different departments. We'll take the first part of that, and or the mention of training centered around health intersections, housing opportunities, expansion, and financial empowerment.
So I wasn't sure if you were going to respond to that, Lily. So the learning community is open to everyone, and all of our open learning community groups are open to any member of the staff for free. They are optional, so you can attend as many of them or as few of them as you choose, not limited to who you are, you know, as individually on your staff or what have you. So just open access is what you can maybe think of there as it relates to our intensive groups, our intensive learning community groups. Those require application and agencies have to be accepted into that cohort. In the case of achieving equitable outcomes for families, it's a unique intensive learning community group in that it targets individuals. And so individual persons can apply to be a part of that cohort. Historically, for our intensive groups, as well as it is also the case right now for our communities of practice, agency teams apply and usually will organize internally to determine who would represent the agency in those cohorts or communities of practice or intensive learning community groups. The final thing that I'll say about all of them, though, is all of the lessons learned, the resources, we try to distill or to basically summarize to make available to the larger network. And so even though your agency or even though you as an individual may not participate in one of the intensive groups or communities of practice, we're constantly working to like pull out the best of the learning and the best of the resources to make accessible so that anyone in the network can have access to that. And Lily has also shared some of the tools and resources that we have developed that, again, intends to make the resources available along with Community Action Academy.
Team, do we see any other questions?
I think we may have covered them and we are approaching the top of the hour.
Great. So if you do have any more questions or want to contact us about anything, here is our contact information. We'll be sharing out these slides as well as a recording of the presentation by email in the next couple of days. And just to close off, I want to say thank you so much for joining us. Have a good day, everyone.